first questions we'd like you to respond to on your device. Which of the following potentially disruptive innovations do you think hold out the most promise for controlling healthcare costs? Focus hospitals, turning care over to nurses, insurance exchanges, get market forces to set the prices instead of CMS. There are a long list of others, but I'd like to just get your responses to those four. To whoever controls the technology, there we go. Oh my goodness. I have nothing to say about CMS. Good. Okay, we'll come back to this a little bit later. Can we have the second question? Which system do you think holds the potential for improving the quality and the cost of healthcare? The reason I wanted to ask this is, the Canadians and the Europeans are looking to the Americans for maybe those guys have the answer, and the Americans are looking more towards public pay. Maybe they have the answer. So could you just give us your opinion about which of the two systems you think we ought to end up with? Wow. So even though we don't think a lot of our system, it's a whole lot better than the alternatives, it looks like. Super. Well, thanks for giving us those inputs, and I'll try to come back to this one in the middle of my talk as well. I'm really honored that you would give me this opportunity. Being an academic is my second career. The first time I had founded and run a company with some MIT professors. The chief technologist from MIT on our team, as I got to know him and his work, it became very clear that if they awarded a Nobel Prize in material science, this guy, Kent Bowen, would get the very first one. So I asked him one time, how does it feel to be the top guy in your field in the whole world? And he said, boy, it's disillusioning. Because all my career I was down at the bottom of the pyramid looking up at the people at the top thinking, gosh, those people are smart. And now I'm at the top looking around thinking, holy cow, if nobody's smarter than me, the world is in real trouble. And I feel the same way when they ask somebody like me to speak at a conference with people like you in it, that if this is all they could get for a keynote speaker, the healthcare industry is in real trouble.